Dr. Oppenheimer is one of the most recognized kidney transplant experts in Spain. He's the head of the kidney transplant unit at the Hospital Clínic de Barcelona. He is devoted to promoting and expanding living donor kidney transplantation, as he believes it's the better option for end-stage renal disease when transplantation is indicated.
I'm involved in transplantology. That means I'm preparing kidney transplants from the medical point of view, keeping care of the patients, the follow-up of the recipients. I've been involved directly in more than 3,000 transplants, kidney transplants.
He could never have imagined that one day he would find himself on the other side of the story when his 29-year-old son Federico was suddenly and unexpectedly diagnosed with ESRD and initiated hemodialysis.
Immediately before he became ill, he was very exhausted, looking very tired, and headaches and breathing difficulties. I suspected it was an anxious problem, not a real illness at all. And finally, one day he suffers from ocular problems, and I took the blood pressure, and I saw it was so high that I suspected that the device was wrong, but it was not the device wrong. It was clearly a very hypertension emergency, and for the reason we took him to the hospital immediately.
Dr. Oppenheimer distanced himself from the medical decision-making process. As a physician, he could not provide medical care for his own son. As Dr. Oppenheimer's capable team took over, he knew that the best treatment option for such a young patient was to receive a kidney transplant once he had been stabilized. And the sooner, the better. From the beginning of the diagnosis, Dr. Oppenheimer's only worry was whether he himself would be compatible and healthy enough to donate a kidney to his son.
The decision of donating was very easy, very easy. I think this was the easiest part of all the process. When I finally confirmed that I was in very good medical conditions and there was not any kind of immunological problem, I became very happy. I was discharged in less than 2 days after the surgery. Then I spent some weeks, in total around 3 weeks of recovery at home. So after Christmas holidays, I was ready to start again with my job.
Dr. Oppenheimer's colleagues consider him to be a hero, but he does not consider himself as one. He believes anybody would have done the same for a son.
This has been a very new experience for us, both for my son and for me. And obviously, it has changed something between us. It has ensured our relationships, and they are more sincere, more profound, and more fluent. Now we are more friends than we were before.
Y bueno, cuando un padre tiene un gesto como este, pues es imposible olvidarlo el resto de tu vida.